Why your bite actually matters in 60 seconds. When teeth bite improperly, they don't line up and the wrong parts hit first. This causes chipping, wear, and gum recession. In some cases, the chipping is so noticeable, the teeth fit together like puzzle pieces. As we age, the chipping gets worse, and eventually we run out of options for how to fix it. If the bite hits in a certain way, we can also have notching at the gum line, which tunnels right underneath the tooth. Teeth can bite poorly in many different ways. Correcting the bite before we see the damage is important because the trauma from a bad bite can end up being expensive and time-consuming to fix once it's too late. What isn't often noticed are the effects of a poor bite on the joint. If the bite causes the bone of the jaw joint to be pushed backwards, the disc can be pushed forward, causing a clicking or popping sound as it dislocates. Putting the teeth into the correct position can fix this issue in many cases or prevent it from ever occurring. Left untreated, crooked teeth can lead to periodontal disease and create abnormal amounts of stress on teeth and jaws, which can lead to premature wear. The effects of crooked teeth can worsen over time and may adversely affect your overall health. Common types of misalignment include crowding, spacing, deep bite, open bite, cross bite, edge-to-edge bite, and excessive overjet. Crooked teeth can affect your periodontal health because it's difficult to remove plaque and bacteria from the crowded areas. Bacteria that is not properly removed will multiply and will trigger periodontal disease, which begins as gum inflammation, redness and bleeding while brushing and flossing. And if left untreated over time, gum inflammation will progress to chronic infection, soft tissue damage and receding gums, periodontal pockets, and bone loss, eventually tooth loss. These conditions can lead to painful repair and maintenance in the future, which could amount to thousands of dollars in expense and countless hours in the dentist's chair. Problems in the oral cavity are best treated in the early stages. Crooked teeth that are left untreated can trap bacteria that damage gum tissue cells and invade blood vessels. This can cause damage to cells that line your coronary arteries, increasing your risk for heart disease, stroke, and other illness. Correctly positioning your teeth for proper alignment and function will help prevent future dental problems and make a significant difference toward a healthy mouth and keeping your teeth for life. At Braces for Faces, we offer clear aligners and braces. Find out which option is best for you. Start on your way to a healthier you today. Teeth move when forces are placed on them. It doesn't matter if this is from braces, a removable appliance, or from clear aligners like Invisalign. Invisalign is a series of clear trays, usually 30 to 40, that are generally changed one time per week. They are custom made to gradually change the tooth positions. Aligners are very efficient because they hug the teeth in 360 degrees instead of just on one side like with braces. In a recent study of braces and aligners, the average treatment time for braces was 22 months, while the average time for aligners was just 18 months. With braces, all of the teeth are strapped together, similar to how everyone is connected in a tug-of-war. All of the teeth must move together. With aligners, because the teeth are not strapped together, they can move individually, almost like soccer players. Every tooth moves independently, in whichever direction it needs to move. When braces are tightened, we bend wires to see how much the teeth will move. If it's not enough, we bend the wire even more. If it's bent too much, we try to bend the wire back. This is reactive orthodontics. With aligners, each tray is programmed to move the teeth exactly where they should be going, so there are no wasted movements. This is proactive orthodontics. It's the difference between taking a film picture and finding out 2 weeks later how it looks when it's developed versus taking a picture on your iPhone and knowing immediately. Although attachments are still needed on the teeth with Invisalign, according to a recent study, these little bumps of composite are not visible to 9 out of 10 people from more than 5 feet away. If patients are not compliant about wearing their aligners, we can change them over to traditional braces at any time. We do not charge anything extra to do this, as we are charging for the cost of treatment, not the way in which we treat them. Teenagers and preteen patients are actually very compliant to wearing their aligners, since the alternatives of headgear, herbs appliances, and twin blocks are much more uncomfortable and socially awkward. Invisalign allows us to design every movement before we even touch the teeth. Having this plan allows us to see patients every 3 to 3 months instead of every 4 to 6 weeks like with braces. As long as the aligners are fitting the teeth properly, we just monitor them to make sure the movements are happening as planned. We can even monitor virtually and weekly. With traditional braces, emergencies are fairly common. Over the span of a 2-year case, there's an average of 4 emergency appointments. These consist of broken wires, loose brackets, or wires poking their mouths. With aligners, the average is less than 1 emergency appointment for every 2 patients. If an aligner is broken or lost, it's not a big deal. The patient just switches to the next aligner and wears it for a few extra days. With aligners, there are no restrictions in food. Since aligners are changed frequently and foods do not get stuck in the teeth like they do with braces, you do not need to worry about getting bad breath. Patients who wear aligners are much more compliant with wearing retainers after treatment is completed because they are used to them. What's the cost difference? We charge the exact same price as with braces. When choosing between braces and aligners, the choice is easy. Aligners are more hygienic, with fewer cavities. They are more comfortable, with less emergencies, and require fewer appointments. They are also more aesthetic, and there are less sports injuries. The treatment time is faster, and the patients are more comfortable. All of this while being the exact same price as braces. In 20 years, when we look back at how orthodontics was done, it will be crazy to think we glued metal to teeth and then strapped wires into the mouth to make them move. Modern orthodontics straight wire was designed and invented in 1963. It's time that we brought orthodontics into the 21st century.